Hi everyone, and welcome back to my channel. Thank you very much for tuning in. So first of all, I'd like to apologize in advance because during today's video I will be doing a lot of looking down just to remind me of my notes, because I've written down a few quotations, and in order to quote them properly I've written them down. So I will be doing a lot of looking down time and time again, so apologies in advance. The video as well, it might seem a little bit unstructured and all over the place, but hopefully you'll get all the information I want to make sure that you get today. So let's jump right into it. So today's video will be about autism itself. So I'm going to look at a definition. So I've looked at some definitions from the World Health Organization, the National Autistic Society, and the CDC. So we're going to look at official definitions of what autism is. I also want to look at diagnosis. So how does someone get diagnosed? I would also be looking at the signs, and then causes, and to finish off a cure. So yeah, so let's start with the definition. So I'll start with definition from the World Health Organization, which is the most complex definition. Okay, so quote unquote, autism spectrum disorder refers to a range of conditions characterized by a degree of impaired social behavior, communication and language, and a narrow range of interests and activities unique to the individual and carried out repetitively. So that's a bit of a mouthful, and it's very professional. That's that definition. That's the World Health Organization. Second definition I've got is from the National Autistic Society, which is UK based. And they've got autism is a lifelong developmental disability that affects the way people perceive the world and interact with others. Okay, so they've also got as well, autistic people see, hear, and feel the world differently. Okay, third and final definition I've got from the CDC, which is the Center for Disease Control. Autistic spectrum disorder is a developmental disability that can cause significant social, communication, and behavioral challenges. That's a brief excerpt quoted from their definition of autism. So all in all, they have kind of said the same thing in different ways. So from that, we've gathered that it is a lifelong developmental disability, and it does create challenges for the person in terms of their communication, the way their communication develops, the way they develop social skills, and it can have a significant impact on the way they live their lives and the impact it has on those around them. So that is the definition of autism. Me personally, in my experience, it more or less covers it, because my son, he does have communication difficulties, social difficulties, and because of that he can't really, there is a huge barrier by how we communicate, but I will cover that in another video. So moving on from the definition, second thing I wanted to look at is diagnosis. So children, this video is mostly about children, or I wouldn't say young adults, but children, because I don't know much about young adults or adults. So I'm going by, this is for children. So children are usually assessed by a doctor and usually have another professional present during the assessment where the person is diagnosed. So it's, for me, it was a speech and language therapist, and I think it's usually a speech and language therapist along with a doctor who's a pediatrician. So it's usually those two professionals present, and they assess the child's behavior and they come up with a diagnosis that the child is autistic. So that's usually how it goes. As far as I'm aware, there are no medical tests like blood tests or scans or anything like that that can be used to get a diagnosis. I've heard people say things, but I cannot see how blood tests can be used to create a diagnosis. Okay, so that is diagnosis, and everybody I've known, that is usually the process. Pediatrician and another professional, usually a speech and language therapist. Thirdly, I wanted to cover the signs. So I've got this information from the NHS website, and I've gotten a few bits from the CDC as well. Most of the information is more or less the same, but you know, those are the two websites I used to get that information. So signs, and this again is in younger children. As I said, I don't know much about young adults or adults. This is for younger children. So signs include not responding to their name when they're called, avoiding eye contact, repetitive movements like flapping, flickering fingers, or rocking. So flapping is usually this, or flickering fingers is that, and rocking is kind of self-explanatory. Repeating the same phrase or echoing words or phrases that others have said to them. Not talking as much as children their age. Getting very upset by certain sounds, smells, or tastes. Not smiling when you smile at them. And some of them lose a skill that they've once had, and some of them have trouble understanding the feeling of others. So these are a few signs. I'll run through quickly these signs and my personal experience. So not responding to their name. Yes. I thought my son had a hearing problem because I would be calling him over and over. I can be standing like a couple inches away from him, and I'll be calling him and he would not turn around. I thought he had a hearing problem. This was before he was diagnosed and before I had done all my reading and research and all of that. So yes, I can definitely relate to that. Now he responds, but when he was younger, no, I couldn't get him to respond to his name at all. Avoiding eye contact. That is another thing I can definitely say I had an issue with. Not anymore. He's grown out of it. So as I said in a previous video, he would go out of his way to avoid eye contact. So you'd call him when you do kind of get him face to face, he would look around, he'd look everywhere else and try to do his utmost best to avoid making eye contact. So repetitive movements and flapping, flickering. So that wasn't an issue for me until later years. So we never did any flapping until he was about 5. But it wasn't a sign of autism because he didn't develop it until later on. And the finger flicking as well, he does it on and off. It's not a regular thing, but again, that was when he was older. And rocking is not something I've seen him doing. But he does have other repetitive movements and activities that he does or focuses on. So it used to be numbers and letters were his absolute core focus and his go-to. If he was upset, it would always be numbers and letters. I mean little plastic ones or magnetic ones, foam letters and numbers. That was him. He's grown out of that a bit, and there isn't anything particular that I would say he draws to, but that was it. And the iPad, of course. Repeating the same phrase or echoing phrases and words, definitely. So when we've been trying to get him to communicate with us, so we'll tell him the name of things. If he doesn't know, he'd sometimes make a word up, but we'll tell him the name of things or use a phrase and he literally just repeated back. I mean, that's an echo, isn't it? So that again is something we went through. Not talking as much as his peers. Zuri doesn't talk really. He probably will say one or two words and the rest of it is echoing or repeating things he learned at school, like nursery rhymes or the names of vegetables or the names of shapes. So, but in terms of effective communication and saying something he wants, there are only probably like 5 words he will use. So not talking as much as appears, that covers that. Getting upset by certain smells and tastes and sounds, that I'm not sure about. Sounds, he doesn't really like loud sounds, so he'll do a lot of covering his ears. Would he get upset? It depends. If he's tired and he wants to sleep, he will. But other than that, I wouldn't say he gets upset. He'd probably just cover his ears. Anyway, the list goes on. I would like to cover lose a skill that they once had. So when he was younger, he fed himself and he did a lot for himself, and he tried using more words when he was younger. I mean, that would be between 18 months and 3. However, beyond those years, when he was 3, 4, he stopped feeding himself and he wouldn't eat unless you fed him. And he stopped saying certain things, like initially he would on and off say mommy, but that is now a no-no. But in terms of losing a skill they once had, definitely feeding was a problem that he stopped doing. Now he feeds himself. Sometimes he wants you to feed him, but most of the time he'll feed himself. Right, so that covers the signs. Causes, right. So this is a area that is under investigation. They're doing research into it, etc. There isn't any specific cause. I think there has been some links to environment or genetics, but there's nothing concrete. So you hear people saying all sorts, but as far as I know, there's nothing concrete to say that anything causes it. There was talk long time ago about the certain vaccinations, but there isn't any evidence to say that vaccines cause autism. So just to clear that up, there isn't any cause, and it's still an area that is really researched, because there isn't a cause, a specific cause. And then moving on to the cure. So just to make it clear, there is no cure. When people say a cure, they probably refer to interventions and strategies in order to essentially give that person a better quality of life. So it may be interventions into their communication. So it may be speech therapy as an intervention, occupational therapy, maybe occupational therapy, maybe, for example, when Zuri was having problems feeding himself or making too much mess, I got these special spoons for him that enabled him to kind of bring his food to his mouth easier, and that worked an absolute treat. So from there he was able to move on to normal cutlery, so he didn't have to use the kind of bended ones anymore, but it worked an absolute treat. Behavioral treatment, training for parents, guardians or caregivers. So that will be making sure that parents or caregivers receive training about different things. It can be communication aids or visual aids, or maybe ways of identifying behavioral issues or how to deal with it. So I think when they refer to training for those for parents like myself, that's what they mean, because I did have training with the speech and language therapist in terms of using communication and visual aids, and other training looking at how to identify problems that may cause a meltdown and how to deal with it and things like that. So that's that. And I've also heard some heard about a dietary approach. Again, there's not evidence to suggest that it does work, but I've heard one person actually tell me that she knows somebody who cut certain food items from their child's diet and they improved. I don't know. There isn't solid evidence to say that it does. But that's a school of thought, dietary approach. I haven't done much research into it. I'm sure there are, you know, papers written about it or books, etc. But I personally haven't done any research into that, so I'm not going to go into it anymore. Medication. So there is no medication for autism, but there is medication that can help improve a person's functioning. So there may be medication to help with their focus, to help them focus, maybe medication to help with managing high energy levels. Also a medication for anxiety, for example. So not for ASD, but some of the characteristics of autism. So that covers the cure. I just wanted to, really, before you switch off, I wanted to make sure I reiterated that autism is a spectrum condition. No two children are the same. No two characteristics will be the same. People with autism, they see the world differently. They feel the world differently. And within that, they all have different ways in which they see and feel the world. So, the worst thing you can do as a parent is try to compare your child. They're all different. I had my time where I was comparing, and my child is different from what everybody else is. I definitely have gone past that, and Zuri is Zuri. I just do my utmost best to make sure that he in the end will hopefully have an independent and fulfilling life. It is hard work, but nothing worth having is easy. So what else did I really want to say? With the right help and support, most people have an independent life. By help and support, it's the things I mentioned earlier. So it could be communication aids, making sure that the people who look after you or who surround you are well educated about autism. Maybe whether or not the child might need to go to a specific type of school, or if they're in mainstream school, making sure that they've got the resources in place to make sure that child is included within the mainstream school. I'm going to do another video about mainstream school and my experience. So that should be my next video. So I look forward to doing that hopefully this week. But yeah, hopefully this video has been informative for somebody. And if you do have any questions or comments, do not hesitate to leave it below, and I'll get back to you as soon as I can. And please subscribe. I have a lot more information I'd like to give and offer. And yeah, I'll see you guys in my next video. Have a good one. Oh, by the way, I hope you guys are coping well with the COVID-19 and all the craziness that's going on at the moment. Yeah, okay, see you guys. Thank you for watching.